Great. Well, the next couple of questions I'm going to combine because they actually speak directly to your call to the next generation. So for people working in global health, what would you identify as some of the most significant skill sets to becoming a leader in global health? And, if you can reflect also on students interested in a career in global health, what advice do you have for students to develop these skills and address the future and ongoing crisis? So I guess it's basically career advice based on your extensive and diverse experience for any student who wants to pursue a career in global health, including with the WHO. Any advice you would have?
Yeah, thanks. I mean, it's a real privilege to actually be able to have some time on that topic because I feel so dedicated to young people. Let me just say up front that on Twitter, I'm at Peter A. Singer, and I'm happy to continue to interact with young people and people listening to this as we go along. At Peter A. Singer. Let me just say a few things that I've learned. The first one is that it's really important to fail and to learn from failure and to learn the lessons and learn them quickly. So the ability to be mindful about your own failures, and we all fail. I've had huge failures. We all fail, and to learn from it and move on is extremely important in the skill set. I'm not answering in terms of content, I'm actually answering in terms of attributes. Secondly, my advice to young people has always been find a problem and solve it. Find a problem and solve it. Because only through that kind of action, and sometimes you'll fail and then you'll move on to a bigger problem, only through repetitive problem solving, and that can mean a problem in political science, it can mean a problem in scientific testing, diagnostic testing, find a problem and solve it. And thirdly, I would say if you see a rocket ship, hop aboard. So if you see something that's really moving, hop aboard. Get yourself a mentor. Ask yourself, who is doing now what you want to be doing in 10 years? Who's the most, and that is, I think, really important. And then finally, I'd like to come back to the point about gender equality, Black Lives Matter. I think all of us need to really be mindful about our own privilege and about making way for a new generation of leaders. You mentioned women leaders, leaders from racialized communities, because until we have that kind of strong representation in leadership, and the talent is there, we just need to recognize it and support it. And so I guess those 5 things may be too much to, more than what you were bargaining for, Erica, but I really feel passionate about all of us being able to provide our best advice to young people to make it as efficient and effective as possible for them to achieve their full potential. And like the students and like the young people that are part of the organizing committee here, and like the people that are listening, and like I'm sure the people in your classes. So I don't know if you find, or if people find those types of things useful. Often it's very particular to someone's particular situation, but just off the top, there's some suggestions that I might have, or some thoughts.
Do you feel that there's an area of global health that is underexplored by existing curricula and in research that students could benefit from learning more about or exploring?
Yeah, I mean, rather than answering in terms of a specific domain, because then I'd be arbitrary, let me answer in terms of a principle. And I think this is useful. I hope this is useful for people. You know, our mindset is often to go where the hot topics are. So we all go to areas that we think are, but one thing that people might consider is to go where other people are not. In other words, what are you passionate about, where you feel a particular perspective, a particular approach, a particular focus can make a difference in global health or in domestic health, because health is universal, and that is really underrepresented. And maybe that's the way to think about it. Just as a concrete example, I learned this when I went into bioethics in the early 1980s. Very few people were talking about bioethics at that time. And certainly those that weren't talking about it in the way of developing kind of constructive tools on the inside of a profession. It was mostly a kind of philosophical critique of outside the professions and institutions. And so, that's the point at which I learned that you want to go to where people are not rather than where people are. And I just use that example, and, apologize for using one from my own experience, but I think in terms of where people should focus in global health, they should focus in an area they're passionate about.
Mm-hmm.
They should focus in an area that leverages their skills. So if you're a laboratory scientist, don't dig a well for water. If you're an engineer, dig a well and maybe don't do PCR. Leverage what you've got, go into an area that you're passionate about, but find a place and an approach where people are, are not.
Mm-hmm.